Hi, you're on the Bible Forum. I'm Warren Sprouse. I hope that your world is a little bit better today. I want to talk to you about the COVID shutdown. Do you know what the COVID shutdowns are about? I know you got your ideas. You got more ideas than I do. But I start off by just pointing out with a question. Who said shutting down the country does not work? Something I don't think we could possibly do in the United States. Who said that? I can't imagine shutting down New York or Los Angeles, but the judgment on the part of the Chinese health authorities is that given the fact that it's spreading throughout the provinces, it's their judgment that this is something that in fact is going to help in containing it. Dr. Fauci, January 24th, 2020. The shutdown was a Chinese invention. They said. Our experts looked at it and said, we don't think so, but we'll do what the Chinese tell us to do. I read somewhere where Dr. Fauci's wife works for an outfit in China. Just saying. The World Health Organization's report discusses why quarantine is ineffective. That was in 2019. And I quote, in a table, WHO lists their recommendations of MPIs depending on severity level. An MPI is a 10-digit numeric identifier used by healthcare providers, healthcare plans, and employers to determine severity. For COVID-19, quarantine of exposed individuals is categorized as not recommended in any circumstances. In the text we read, quote, home quarantine of exposed individuals to reduce transmission is not recommended because there is no obvious rationale for this measure, and there would be considerable difficulties in implementing it. Number 3, who acknowledges, that's not a question, the World Health Organization acknowledges social distances did not stop or dramatically reduce transmission during the 1918 influenza pandemic. They issued that report in 2006. That wasn't a generation ago. The WHO authors ultimately conclude that MPIs, including quarantining, requiring better and more focused methods to make them more effective and less burdensome, don't work. Ill persons, the author asserts, should remain home when first becoming symptomatic, but forced isolation and quarantine are ineffective and impractical. Number 4, a study in the Bulletin of Mathematical Biology regarding the 1918 influenza pandemic in Canada also concluded quarantines do not work. 2003. The study simulated different levels of travel and found that travel limits could be effective, but that, quote, that a policy of introducing quarantine at the earliest possible time may not always lead to the greatest reduction in cases of a disease. End of quote. The authors conclude that, quote, quarantine measures limiting intercommunity travel are probably never 100% effective, and simulation results suggested that such a situation may actually make things worse, especially in the absence of strong efforts to keep infectious individuals isolated from the rest of the population. Number 5, popular author and Tulane adjunct professor John M. Barry, a strong opponent of the Great Barrington Declaration, argued that quarantines do not work in the case of the Spanish flu, 2009. Barry found that historically, quarantines have been unsuccessful. He writes, quote, this author supports most proposed MPIs except quarantine, which historical evidence strongly suggests is ineffective. and possibly school closing pending analysis of recent events. And instead promotes commonly touted measures such as remaining home when unwell, isolating from family members while doing so, frequently washing hands and wearing a mask if you're sick, not to protect you, but to protect us from you. On that latter point, he warns against healthy people wearing masks. He notes, quote, evidence from the SARS outbreak suggests that most healthcare workers infected themselves while removing protective equipment. Number 6, Seton Hall's Center for Global Health Studies director says travel restrictions did not delay the transmission of SARS, 2009, and had only limited benefit in stopping the spread of disease, affecting travel and trade, dissuading the very kinds of transparency and openness essential for a global response to disease outbreaks. Number 7, a study from Wake Forest University encounters, quote, self-protection fatigue, end of quote, in simulated epidemic, 2013. Their study used a multiplayer online game to simulate the spread of an infectious disease through a population composed of the players. The authors found that, quote, people's willingness to engage in safe behavior waxes or wanes over time, depending on the severity of the epidemic. Some of us just say, duh. As time goes by, they say, when prevalence is low, a self-protection fatigue effect sets in whereby individuals are less willing to engage in safe behavior. They say this is reminiscent of condom fatigue, the declining use of condoms as a preventative measure in the context of HIV and AIDS prevention. Number 8, in the biosecurity and bioterrorism journals, Johns Hopkins epidemiologists reject quarantines outright. 2006. The article is entitled Disease Mitigation Measures in the Control of Pandemic Influenza, end of quote. The Johns Hopkins University epidemiologists note problems with lockdowns. One is that experience shows there's no basis for recommending quarantine either of groups or individuals. Secondly, the problems in implementing such measures are formidable. And thirdly, secondary effects of absenteeism and community disruption, as well as possible adverse consequences, such as loss of public trust in government and stigmatization of quarantined people and groups, are likely to be considerable. End of quote. You'd think he was writing an article based on his observations today in our society. Their concluding remark emphasized, quote, experience has shown that communities faced with epidemics or other adverse events respond best and with the least anxiety when the normal social functioning of the community is least disrupted. Number 9, in the American Journal of Epidemiology, authors explain the conditions when quarantine would be effective, guidelines which do not align with the characteristics of COVID-19. That in 2006. Specifically, they note that quarantines will only be effective when 1, isolation is not possible. Number 2, asymptomatic spread is significant and timed in a narrow way, none of which is the case for COVID. They concluded that the number of infections averted through the use of quarantine is expected to be very low, provided that isolation is effective. And if isolation is ineffective, then it will only be beneficial, quote, when there is significant asymptomatic transmission, and if the asymptomatic period is neither very long nor very short. But should mass quarantine be used, it would, quote, inflict significant social, psychological, and economic costs without resulting in the detection of many infected individuals, end of quote. Number 10, in the Epidemiology Journal, Harvard and Yale professors Mark Lipschitz and Ted Cohen say delaying infection can leave the elderly worse off. 2008. They explain how delaying the risk of infection can work counterintuitively when the pathogen is more lethal for older populations. They say reducing the risk that each member of the community will be exposed to a pathogen has the attendant effect of increasing the average age at which infections occur. How? By shifting the burden of infection toward older individuals. Based on this analysis, COVID-19, which disproportionately harms the older more than the younger, is better handled by allowing the community to be exposed, whether through natural infection or vaccination. Number 11, a team of Johns Hopkins scholars say quarantines did not work, but are pursued for political reasons. September 2019. In the report, they explain how quarantine is more political than related to public health. I quote, during an emergency, it should be expected that implementation of some MPIs, such as travel restrictions in quarantine, might be pursued for social or political purposes by political leaders, rather than pursued because of public health evidence, end of quote. Later on, they explain the ineffectiveness of quarantine, writing, in the context of a high-impact respiratory pathogen, quarantine may be the least likely MPI to be effective in controlling the spread due to high transmissibility, end of quote. Now keep in mind, an MPI is a 10-digit numeric identifier used by healthcare providers, healthcare plans, employers to determine severity. In March 2020, Michael Osterholm, now Biden's COVID-19 advisor, also argued that lockdowns are, quote, not a cure for the pandemic, listing multiple costs from a lockdown. Yet Osterholm's New York Times article in August reveals a contrasting viewpoint, stating that, quote, we gave up on our lockdown efforts to control virus transmission well before the virus was under control by opening too quickly. Osterholm and Neil Kashkari promote a mandatory shelter in place for everyone but the truly essential workers. Also in 2020, March 2020, these findings from the listed works of many others culminated in an open letter to Vice President Mike Pence, signed by 800 medical specialists from numerous universities throughout the country, which pointed out mandatory quarantine, regional lockdowns, and travel bans are difficult to implement, can undermine public trust, have large societal costs, and importantly, disproportionately affect the most vulnerable segments of our communities. I shared that with you months ago, 6 months ago. So, why are we doing this? And why is it so important that laws be passed to fine or imprison people who refuse? I don't know. I got an opinion. You knew I did. I think it's a test. If it works, and it's about 50-50 now, it could be used again on almost anything imaginable. Can you say, I don't know, 666?